Good afternoon again with audio-vestibular medicine, which is a specialty including all basic and advanced aspects of sciences related to auditory perception and balance. Clinically concerns or prophylactic screening, assessment, treatment, and rehabilitation of hearing, auditory perception, communication, and balance disorders from birth onwards. Now with the second lecture about vestibular assessment. As we can see from this unbalanced, unsteady animation, balance and equilibrium means that I can feel myself, feel my head, feel my body, feel my step on the ground, stand, sit, move, turn, round, walking, running, balanced and with equilibrium. The vestibular system is the major input for balance and equilibrium, beside also the visual system and the somatosensory system. The vestibular system consists of three semicircular canals: vestibule, vestibular nerve, central vestibular pathway. The vestibular pathway, the peripheral part, which includes the lateral, anterior, posterior semicircular canal and the vestibule, utricle and saccule, and the both branches of the vestibular nerve transmit the impulses or the sensation to the vestibular nuclei in this central part, going through the brainstem, through the oculomotor pathway, oculomotor nuclei and eye muscles, finally to the eye movement to control the eye movement. And on the other side of the vestibulospinal pathway, going from the vestibular nuclei to the spinal cord to the body muscle to control the postural movements. Both of them, oculomotor pathway and vestibulospinal pathway, have an input from the cerebellum and of course finally the cerebral cortex. The oculomotor pathway and the vestibulospinal pathways are tested depending on the vestibulo-ocular reflex and vestibulospinal reflex based vestibular testing. Clinical assessment of a dizzy patient includes history, which is very important, general and otologic examination, neuro-otologic examination, including the office test we will go through, and cranial nerve examination, vestibular investigations. We will name some of these vestibular investigations, and referral, the most important, is imaging. The office procedures assess functional status of balance, but of course of variable sensitivity and specificity. But the advantage that it is simple, could be used in the office without advanced equipment. The methods include stance and gait, limb coordination, nystagmus, spontaneous and evoked, positional positioning, and dynamic vestibular testing. First, the stance. We are asking the patient to stand to test the proprioception, and we asked him to or the patient to close his eyes and putting the feet near each other or in front of each other, or putting the hands in front of us to do sharp Romberg test. If the first Romberg test without this sharpening is done well. And look for a sway to the right or to the left, and or for instability. Swaying to one side, it is usually the weakened side. Clinical test of sensory interaction of balance, CTSIB or CTSIB. It is the same idea like Romberg, preventing vision and somatosensory input to test for near pure input of the vestibular system on balance. The gait, asking the patient to walk and looking for abnormalities. Also the tandem walking, asking the patient to walk heel to toe walk. It's very difficult, even with mild vestibular pathology. Stepping test is asking to do the patient to do stepping and close his eyes and raise his hands and look for a sway to the right or to the left. This might indicate also the weakened side, and sometimes forward walking, sometimes or forward movement sometimes indicate auricular lesion. Limb coordination, rapid movement dysdiadokinesia, finger to nose test to look for dysmetria or tremors. This point to if abnormal to a cerebellar lesion. Eye assessment, ocular tilt reaction. This is sensitive to central lesion but may occur in lesion affecting otolith ocular pathway. By putting one hand on one eye and looking abruptly for the movement of the other, if we remove our heads. Also, we can check for the field of vision. Nystagmus. Searching for nystagmus. Nystagmus is involuntary rapid rhythmic eye movement, sometimes suppressed by fixation, so that we use the Frenzel lens to look for these suppressed nystagmus. We can look for nystagmus, for spontaneous nystagmus, in a central gaze looking forward, and in a lateral gaze 30 degrees to the right or to the left, and also up and down. The type of nystagmus, horizontal, vertical, rotatory, will help us to locate the side of lesion if it is horizontal and it is peripheral, and also to indicate if there is a possibility of central lesion if it is vertical, and some types of rotatory nystagmus. Static positional test. Place the patient in several positions and looking for nystagmus. And positional nystagmus is non-localizing unless we find a vertical which is central, but it can indicate will help in choosing the proper test after that. Dynamic positioning test, looking for the benign peripheral positional vertigo. The most important or the most famous is Dick's Holbike maneuver. Dynamic vestibular testing, actively head shaking and looking for nystagmus and for the type of nystagmus and for the direction of the nystagmus. It will help to sometimes help us in localizing the site and the possible site of lesion. Head impulse test and looking for a corrective saccade is also very important. Dynamic visual acuity, looking for the change of the visual acuity after head shaking. The caloric test, it is a non-physiological stimulus using 30 and 44 degree cold and water irrigation in the external canal with normal tympanic membrane, and observe for nystagmus intensity and duration. Normally we will find an equal response, but this test only investigating the horizontal semicircular canal at very low frequency, each side at a time. After after taking history, doing general examination and office test, we can have a clinical impression. Do I suspect vestibular lesion? And from the history, the onset, accompanying nausea and vomiting, intensity, if there is hearing loss or not, if there is positional changes or not, if there is neurologic symptoms or signs, if there is nystagmus, and this type of nystagmus and direction of nystagmus, and imbalance, mild to moderate or severe, we can suspect peripheral and differentiate from central vertigo. And sometimes I can categorize specific disease. So I can choose, if I'm not sure, to go through a quantitative and also accurate vestibular testing. This test includes video nystagmography, video head impulse test, VAM, rotary chair, postrography, and others. These testing are complementary, and sometimes I need one or more of them to accurately diagnose the side and site of the vestibular affection. Finally, I have to differentiate vertigo from unsteadiness or lightheaded or pre-syncope. And with vertigo, I have to diagnose if there is acute vestibular syndrome, peripheral or central, from episodic, peripheral and central, episodic spontaneous or episodic positional vertigo, paroxysmal or non-paroxysmal, paroxysmal benign peripheral positional vertigo or central, non-paroxysmal peripheral or central, and then go through intervention, which might be pharmacotherapy, surgical, or vestibular rehabilitation, or a mix of one or both or the three. Pharmacotherapy of vertigo includes some specific medications or symptomatic medications or prophylactic medications, and sometimes other medications in some special cases. Now we go for the vestibular and balance rehabilitation therapy, which is an exercise-based approach aiming at maximizing the use of residual vestibular and balance function, with the goal to ameliorate the symptoms of vertigo and dizziness and improve the functional disabilities of dizzy patients. Vestibular rehabilitation must be done in the proper timing, using either conventional virtual reality or cognitive behavioral therapy. To conclude, full history, medical examination, audio-vestibular investigation will finally lead to a diagnosis and the choosing the intervention preferred, or sometimes referral according to the diagnosis, and also will help to properly select the vestibular rehab within the sensitive period. And all of these needs the follow-up. Thank you. We will go through the clinical application of all of these, what we have mentioned, in the small session group, and application of all of these testing. Good luck and bye-bye.